now. So, okay, magandang gabi, maayong gabi sa inyong tanan. This is Dr. Joe Flordelis, and this will be my last live before I go on a leave. And if you are hearing me loud and clear, maayong gabi sa inyong tanan. If you have questions, karong gabi una, please do message in the comments if you can hear me loud and clear and where you are from. Taga Cebu ba mo, taga Bohol, Visayas, Mindanao, Luzon. Let me know where you are from before you ask your questions para matubag nato ang inyuhang mga pangutana karong gabi una. So again, we are live here in Cebu City. Ako si Dr. Jonathan Flordelis, your Cebuano hip and knee specialist. Ug atong topic karong gabi una is hip osteoarthritis. So if you can hear me loud and clear, let me know if you have questions about kaning mga hip or knee osteoarthritis. If you didn't know, we do have a Facebook group para sa atong community na gitawag og Hip and Knee Arthritis Philippines, where you can ask questions and of course message me directly, and also you can talk to other patients na naa say mga hip and knee osteoarthritis. So again, maayong gabi sa inyong tanan. You can call me Dr. Joff, your trusted source sa mga hip and knee arthritis na information. Ug karong gabi una, adto ta sa topic na hip osteoarthritis. The time is currently 6:11, and yes, if you do have questions, you can definitely ask away kung naamoy pangutana about kaning hip or knee osteoarthritis. So, a little bit lang about the clinic. Kay it is the 25th year anniversary sa Cebu Orthopedic Institute. Mauna ang amo ang clinic. That's 25 years of world-class na orthopedic care. If you didn't know, asa among clinic na amin sa Robinson Cybergate across Chongwa Fuente. So, yes, dili na pasabot na 25 years na ko sa clinic, but definitely ang clinic has been there since 1999. Little bit about osteoarthritis. Unsa man ni, shortcut lang, it is a wear and tear of the joint. Pareha anang auto, ang ligid magsigigdagan, the tire or gulong slowly mahilis na siya. The cartilage will slowly wear down with time. Of course, more ni sa mga weight-bearing joints, kung naasay mga risk factors like family history, kung naay arthritis sa pamilya, labi na arthritis sa hips. Also, these are common ang hip arthritis more sa mga Caucasians, no? Unsa man ang mga Caucasians mo na ang mga Europeans, Americans. So, hip osteoarthritis naasad ni sa mga Filipinos but more common sa Caucasians rather than mga Asians, no? Asians usually more sa mga knee arthritis. Kani na slide is just showing you na kanang puti on the top, that is actually your cartilage. Baga-baga na ang cartilage pareha sa ligid sa auto. And if you do have a car wheel, once mahilis ng ligid or the rubber, then you will have already the steel belt or yung tinatawag nato na bone. So sa ilawom sa cartilage, that is our bone. That is the brown that you see in the slide here. So if you have questions about arthritis, about the cartilage, let me know if you have these questions po, mga arthritis warriors. Moni ang cartilage and mauni ang bone. So I'm just making this a little simple, no, para kasabot mo na baga-baga gid ni, but through time, through risk factors, and sometimes also there have been diet na, so they are saying that diet and kanang gitawag og inflammation sa imong gut can actually cause osteoarthritis, kaning also known as degenerative changes in the joint. Degenerative meaning naghinay-hinay o kaguba ang joint, especially ang cartilage. You will see here the white part or the cartilage has already been damaged. And this is again advanced osteoarthritis na nangapahak na ang cartilage sa atong joints. And lastly, degenerative end-stage disease, where you will already see the loss of almost all cartilage na bukog na gyud. And if you see the picture, the hip is no longer round, it is deformed, and that's why patients have difficulty moving their hip joint. Sometimes dili na sila makahinambid, makadikwatro, no longer able to do the figure of 4 sa paglingkod. Sometimes they have problem walking and makit-an man ni sa x-ray. So that is the simplest test, getting an x-ray. And here is a cartoon representation of kaning arthritis, no? From a normal joint under the muscles, that is the joint, and that is the arthritis that happens through time. And yes, ano ang signs and symptoms ng arthritis? Remember mo ni ang atong klaro lang sa mga arthritis warriors. The hip joint is not actually sa kaning actually ni sabugan, no, sa may punuan sa singit, the groin pain. So kung akong ipakita ninyo, this is not actually the hip joint here. Actually naa sa may bugan ang hip joint. So if you have pain sa bugan, sa groin, sa singit, that radiates to the thigh, posible na naatay kanang gitawag og hip pathology. And one of the common hip pathologies or hip problems can be hip joint osteoarthritis. Some of the signs and symptoms, maglisod na og lakaw, magtakiang na, sakit ang bugan, pain in the groin. Sometimes mubo na, shorter ang affected extremity, and they have already a posture na naka-flex, naka-bend ang ilahang thigh and hip joint, because they are no longer able to straighten it. It happens with a severe or very severe arthritis. So good evening ninyong tanan, also sa mga top fans out there. Let me know where you are from so I can give you a shout out. Shout out to our top follower na si Ma'am Maria Elena Mantaring. Maayong gabi, Ma'am. And Maria Elena Mantaring is from Cebu. And of course, the X-ray is the simplest test, also one of the cheapest, most effective, because one X-ray can show you na normal ba ang bones or na ay problem. Here, I'm sharing with you the bones are very normal, round kaayo, no, lingin kaayo, and that means that the head shape is intact. Walay arthritis in this hip joint. Sa bugan, normal, naapag yung joint space. But with time, and of course, naasay mga secondary arthritis caused by many other factors, samaan ng AVN, lupus, among others. The narrowing of the joint space nihuot na maunay naa sa picture na naay arrow. This is a normal joint compared to what you have on the left, or it is a severe osteoarthritis na the head has deformed and has a different shape na. Again, this is a normal compared with a osteoarthritis that no longer has joint space. Maglisod na ni og lakaw, there's spur formation, uman na deform na ang head. If you have any questions about hip and knee osteoarthritis, let me know. Of course, good evening, Sir Noel Salan. Shout out to mga arthritis warriors in CDOs from Cagayan de Oro po. Okay guys, if you are listening loud and clear, let me know where you are from, and if you have any questions bahin sa arthritis, no, para matubag nato karon sa atong live. So every weekend we try to answer questions about hip and knee arthritis sa atong mga live sessions. So here are some of the X-ray findings in osteoarthritis. The ball and the socket na naay problem, no, sa atong bugan, sa atong groin, that also mo katay na siya sa thigh and knee sometimes. Remember, atong i-treat ang pasyente, dili ang X-ray, kay sometimes ang mga pasyente chronic pain, dili na sila maka-feel kayo, pero maglisod na og lakaw, dili gyud na always, all the time sakit ang bugan. Definitely, unsa mga options nato mga higala. So mga arthritis warriors, you can try to do a weight reduction protocol. samaan ng mga ganahan mo try og there are many different diets. Ako mismo, I'm a proponent sa kanang fasting, no? Of course, I don't want you to go into a fasting if you have medical problems. So always consult your doctor if you feel you have arthritis, if you feel you have hip or knee pain. Please, please, please consult your doctor para masigurado ta. We want to educate you and so you can know if naabagyon mo arthritis or inyong silingan, inyong kapitbahay na ay arthritis. You can take pain relievers, you can use walking aids, injections, naasay different supplements na pwede nato i-take, no? So, for a lot of the patients, ganahan kumuhatag og paracetamol because it is relatively safe sa tiyan ug sa kidneys compared to a lot of other painkillers, no? So paracetamol, also known as acetaminophen, is very effective and it's been a first line sa arthritis, sa osteoarthritis of the hip and the knee. Of course, daghan mga other pwede buhaton. I also would like to refer to my rehab colleagues, especially labi na ang mga patients dili sila ganahan magpa-opera. Non-operative is of course an option and we want to give them a chance na makatry og physical therapy and rehabilitation before any surgical options. Also, some of the doctors na rehab are doing also mga injection sa hip joint. Hopefully makatabang na sila sa mga arthritis warriors nato suffering from hip osteoarthritis. So, unsa maning mga NSAIDs, magbantay ta kay daghan og mga pasyente na magdugo ang ulcer, bleeding ulcer, musakit ang tiyan if chronic use of NSAIDs. So, di ta ganahan mo gamit ani long term. Nasay uban na makadaot sa heart. So please be careful with your heart. Don't just take left and right mga painkillers, mga arthritis warriors. And lastly, ang mga kidney, ang mga bato, daghan kaayog na kidney failure, na damage ang kidney sa kadaghan nga magsigig inom og mga NSAIDs, also known as non-steroidal anti-inflammatory. In simple terms, painkillers can cause GI bleed, ulcers, heart problems, and kidney problems. So, definitely na atay pwede imnon with the NSAIDs kung naamoy GI problem, sakit ang tiyan, na ay mga antacids, pwede na nato imnon, no? And also, kaning naproxen is a better compared to the others if you have heart disease. Compared sa mga COX-2, mga coxib. You want to avoid diclofenac and ibuprofen if na heart problems. Kung pag yung kidney problems, ayaw na lang pag NSAIDs. Always, again, consult your doctor. And if you have severe na arthritis, you can ask your friendly na orthopedic doctor bahin sa kanang gitawag og hip replacement na surgery. So, this is a hip replacement. Atong pulihan ang kaning gitawag og ball and socket joint sa atong hips. This is for severe cases kanang para makalakaw og usab ang mga pasyente. This is an x-ray na both hips na napulihan ang hips sa pasyente. Some patients before surgery maglisod og lakaw and ang uban magtakiang gyud, maglisod og lakaw, magtakiang and magkasakit, magkadugay ang hips. That is why we do this surgery na gitawag og total hip replacement surgery. After surgery, you will notice na mas makalakaw og dali and that is our goal, to put the ability back in your life so that you can do the things that you want to do, no? So kanis atong pasyente ni larga na ni sa US. All these, of course, videos were taken with permission sa atong mga pasyente. And I wish them safe travels kay ni larga na lagi ni siya sa abroad, mga arthritis warriors. So, if you know someone with hip or knee osteoarthritis, please let them join the Facebook group. Libre ni, pwede mo appeal. And This is the group. Free to join, Hip and Knee Arthritis Philippines. Of course, again, I'm very thankful to be part of the Cebu Orthopedic Institute that has been helping mga patients since 1999. Shout out to Ma'am Maribeth from CDO. Mayong gabi, Maribeth. Maribeth says na, Dok, maunay gibati nako karon, sakit ang kilid sa may bugan, 3 weeks na akong gibati. Anong dapat gawin? Anong gamot i-take? Like we mentioned ganina, you can start with pain relievers, but be careful if you have heart disease, GI disease, or kidney disease. That's why we always want you to consult your doctor. Salamat sa pangutana, Ma'am Maribeth from CDO. So, I will continue na if you are interested in getting a consult from the Cebu Orthopedic Institute na grupo, nami specialista sa tiil, sa kamot, sa spine, sa hips and knees, sa tumor, ug sa pedya, sa mga bata na naay problema na orthopedic, no? Puro mi orthopedic with different subspecialties. You can find us at 401 Robinson Cybergate, just across Fuente Osmeña. And thank you for your time, mga arthritis warriors. I do need to prepare kay mo leave ko. Much love and respect. This is Dr. Joff, putting the ability back in your life. And I hope to see you soon, mga arthritis warriors.